after everyone got all the details of all the seizure medications and how to choose what, now we'll get into more kind of specific considerations. The thing to keep in mind is that the goal of treatment in epilepsy is for the patient to have no seizures and have no harm from the seizure treatment. And this can be achieved in most patients, but in special populations, particularly women and elderly patients, we have to have additional considerations to meet this goal. So we're going to start with treatment of women with epilepsy. We'll start with fertility here, and this question of does epilepsy itself affect fertility? And when you look at population data, women with epilepsy do have lower birth rates in the general population. However, I think it's hard to extrapolate whether this is directly due to the epilepsy or really that there are other confounders to these rates. The confounders include kind of personal decisions, medical comorbidities, psychosocial factors, so there's a lot to play more than just the underlying epilepsy and its impact on fertility in regards to lower birth rates. What we do know, though, is that AED or ASD polytherapy correlates with infertility. And so women on 3 or more anti-epileptic medications are found to have an associated 20-fold risk of infertility. So if they're on a lot of medications, that does seem to have a direct impact on fertility. However, a single medication is harder to say. There is evidence that seizure medications and seizures themselves do alter pituitary function, and so there can be some fluctuations and changes in menstrual cycle and ovulation. So there could be some hormonal components that could potentially make it more difficult to become pregnant. But overall, we don't have clear evidence that outside of multiple anti-epileptic medications, is there a direct impact on the ability to become pregnant. There's always this question, if someone becomes pregnant, what's going to happen to their seizure control? And the best indicator of whether or not a woman will remain controlled during their pregnancy is whether they were controlled in the year before the pregnancy. And so 80 to 90% of women that had seizure control for the year prior to pregnancy will remain controlled during that pregnancy. So that's a very predictive factor and can be very reassuring for women when you are counseling them when they're planning to become pregnant. There can be some change in seizure frequency during pregnancy. There can be 14 to 16% of women can have a decrease in seizure frequency. 14 to 32% can have an increase. So they might have some increase, they might have some decrease. But if they're seizure-free in that year prior to pregnancy, it's most likely that they'll remain seizure-free during the pregnancy. Looking at population data of all women with epilepsy that became pregnant, 50 to 60% were seizure-free during their pregnancy. There's always this concern, what if they have a seizure during delivery or during labor?